Okay, so today we are diving into chapter 3, essential prefixes and more. Prefixes are like the directional signals of the medical world. They sit at the very beginning of the word and radically change its orientation, size, or timing. Master these, and you will unlock half the mystery of the complex clinical jargon. So, by the end of this lecture, you should be able to actively construct and deconstruct medical terms. We will categorize our learning into two main buckets. First, directional, positional, and numeric prefixes, and secondly, combining forms that specifically describe color. Pay close attention to how these colors show up in diagnostic testing and anatomy. So let's start with the numbers. Many of these are intuitive because we use them in everyday English, but let's bridge them to medical terminology. First, mono or uno. Think of a patient with mononucleosis affecting single nucleated cells or unilateral rash occurring on only one side of the body. Bi and di. Bilateral breath sounds mean both lungs are expanding equally. Diplopia is double vision. Tri. Tricuspid valve is the heart valve with three cusps. Quad or tetra. Quadriplegic or tetraplegia. This is paralysis affecting all four limbs. And centi or milli, crucial to pharmacology dosages and metric measurements like centimeters or milligrams. So now let's look at quantities and volume. These are incredibly common in assessing lab values and patient histories. Hyper versus hypo. Get comfortable with the classic pairing. Hyperglycemia is high blood sugar, hypoglycemia is low blood sugar. Hypertension versus hypotension. So these themes will continue throughout your medical terminology. Hemi versus semi. A patient recovering from a stroke might be experiencing hemiplegia, paralysis of one half of the body. Multi versus poly. Polyuria means passing excessive amounts of urine. Nully versus preemie, often used in obstetrics. A woman pregnant for the very first time is a prima gravida. Someone who has never given birth to a viable infant is a nulliparous. Pan or pan, a pandemic affects an entire global population. Pancytopenia means a critical reduction in all cellular elements of the blood. So let's get familiar a little bit more with these terms. So, ab versus ad. Think of movement. Abduction is pulling a limb away from the midline, like being abducted or taken away. Adduction is bringing it toward the body. You are adding it back to the midline. Circum and peri. Pericardium is the sac surrounding the heart. Endo versus exo and extra. An endoscopy looks inside a cavity. An exotoxin is a toxin released outside a bacterial cell. Inter versus intra. Students confuse these constantly. Intercostal means between the ribs. Intravenous means within the vein itself. Post versus retro. Postoperative care occurs after surgery. A retroperitoneal hemorrhage happens behind the abdominal lining. And we covered some of these. So let's look at these positions or directions. So inter, which means between. So intercostal muscles are the muscles found between your ribs, and rib is cost or costo. A memory trick for this is think of an interstate highway. It connects and runs between different states. So I'm giving you this example. So when you're trying to memorize these on your own, you can use different things like memory tricks and mnemonics to help you memorize them. Intra, within. So an intravenous or IV injection goes directly within the vein. A memory trick for this is intra sounds like inside. If something is intravenous, it stays inside the vein. Para, meaning near, beside, or abnormal. The parathyroid glands are four tiny glands located right beside or near the thyroid gland. Paresthesia is an abnormal sensation like pins and needles. A memory trick, maybe think of paramedic. They work beside the doctor to help the patient. Or paranormal event, which is abnormal and outside of the norm. Post, meaning after or behind. Postpartum depression is depression that occurs after childbirth. A memory trick may be think of postponing a meeting. You push it to the time after it was originally scheduled. When we look at retro, meaning behind or backward, a retrocecal appendix is located tucked behind the cecum. This is the first part of a large intestine. A memory trick is to think of retro fashion or music. It looks backward to the past. So let's put our directional prefixes to use right now with nursing pharmacology. Subcutaneous, sub-Q, or sub means under or beneath. This bypasses the skin entirely and drops medication directly into the fatty tissue below, typically 45-degree angle. Intramuscular, or IM, intra meaning within the muscle layer. This requires a sharp 90-degree angle to penetrate deep into the vascular tissue. Intradermal, or ID, intra means within. So an intradermal injection goes flat right into the dermal layer of the skin at a 10 to 15-degree angle, perfectly for the TB shot. Intravenous, IV, intra plus veno, vein, straight into the bloodstream for immediate therapeutic onset. So these terms are vital when conducting neurological assessments or documenting injury patterns. Contralateral, contra means opposite. In head trauma, we often look at a coup contra coup injury. If a patient is struck on the left side of the forehead, but the brain tissue rebounds and hits the right side of the skull, causing pain or damage on the opposite side, that is a contralateral effect. Similarly, the left side of your brain controls the contralateral right side of your body. Ipsilateral, ipsi, means same. If a patient has a blown left pupil and left-sided facial drooping, those symptoms are ipsilateral to the left side brain lesion. So here's a little knowledge check. And after that is a brain break because that was a lot. So once again, get a snack, step away from the computer. That's the important part. So, this matrix helps categorize structural meanings so you can memorize patterns rather than individual words. This, once again, is a really good tactic when studying words to categorize them. So, negation, notice A or AN, it means without or absence of. If a patient is apneic, they are without breathing. If they are anemic, they have an insufficiency of red blood cells. Size, macrocytic versus microcytic red blood cells, literally large cells versus small cells under a microscope. So here's a classic clinical visual pairing. Both of these terms use the root word cardio, heart, and the suffix ia, condition of, ia. On the top rhythm strip, look at how far apart those peaks are. The heart is dangerously slow. We prefix it with brady to get bradycardia. Typically, this means that the heart rate is under 60 beats per minute. On the bottom strip, the waves are stacked tightly together. The heart is racing. We prefix it with tachy, and then it builds tachycardia, typically over 100 beats per minute. So, color roots are absolute diagnostic giveaways. They will exactly tell you what color tissue, fluid, or a cell has turned. So when we look at leukocytes are white blood cell counts. So they're cells that are imperative for immunity. So cyano, or if a patient lacks oxygen, check their lips and nail beds for cyanosis, a bluish discoloration. Erythro Erythema is abnormal redness of the skin, often from inflammation. Melano or melanin gives skin its dark pigment, but a malignant change in those cells results in a dangerous skin cancer called melanoma. Xantho, a patient with high cholesterol might develop xanthomas, yellowish fatty nodules under the skin. So, as we wrap up the structural building blocks, let's look at suffixes. Notice a tiny change in word endings alters the entire meaning from an action to a tool. The trio to know, look at gram, graph, and graphy. This trips up many. So, an electrocardiograph is the physical machine sitting next to the hospital bed. An electrocardiography is the actual process or procedure the nurse performs. The electrocardiogram is the physical paper, printout, or digital record of the heart rate that the provider reads. So here is a knowledge check. Once again, all of the answers can be found in the notes section. And here are the references. So please cross-reference these slides with your assigned readings, specifically the 10th edition of Leonard's Quick and Easy Medical Terminology. So you want to also use the reinforcement exercises in the book as well as the Google Notebook that I provide to enhance your retention of these concepts and terms. And have a wonderful week.